And we are fortunate to have Sherry Kiker back with us again today, our dietitian from the East region that is going to continue her presentation from last month on vitamin D and malnutrition and any other good information she has to provide us. Sherry, welcome back. Thank you for coming back.
Well, thank you for asking me back.
And for those that maybe might not have been here last week, I believe you mentioned that you did have an interesting thing about your cats. Can you
Yes,
share that for us again a little bit?
I have two bobtails, and both of them are multiple, have extra toes. I have one sitting here who was in the camera, but the other one's asleep behind me at this present time. But they all have, they're polydactyl, they have extra toes. And when I share my screen, you'll get to see them. I brought some pictures of them. Now,
Great.
my oldest one is the male Taz. He doesn't have extra toes on the front, but his two of his toes are like thumbs. And they're in the same position that our thumbs would be, and he uses them like thumbs.
Interesting.
Which is a little disturbing at times when he gets into things that he shouldn't be.
I can imagine he could get into more things that way, couldn't he?
He can, because they are also jointed like our thumbs. So he can hook those over cabinet doors and open things that he really shouldn't be.
Well, so for getting started today, do you maybe have a little summary of last week's to kind of catch everybody up to where we're at, or not?
Not really a summary. I will do a little bit of summary.
A little background.
Yeah. We talked last week basically about what vitamin D was and how you acquired vitamin D and what foods it was in, and then why it's being why so many people are deficient in it. And we were talking about the causes, which included poor eating or poor nutrition, and we were on obesity is another cause, and then we were started on medications. And I thought I would start at the beginning of those. I think we talked briefly about one of them, but we may as well start at the beginning of that section and just go from there.
Okay. I really, now that you mentioned that, I really remember that section we're talking about meal times and meal logs that you'd seen from agencies and some of the choices that people were offered, and it just isn't always good.
No, it isn't. They're eating so much processed food, and which really has no nutrition to it at all. It's all been processed out. And I did just before I got on, I saw a study come across from my dietetics association that was talking about processed foods and how the most recent study was showing that it is very closely linked to all forms of heart disease. So the people that eat more processed foods, the more likely they are to have all different kinds of heart disease, including heart failure and death from it. So it was I haven't read the whole thing. I just saw enough of it to know that they were talking about processed foods when we had talked about those being a big part of the meals. So nutrition is a big factor in so many health conditions. Shall we get started?
Absolutely.
Okay.
Because medication is certainly a big issue also.
Yes, it is. and I had a reason I started there is I had a little update on one of the pieces that I shared about how many medications just from skin issues. And I completed the year, and I think last time Dr. Davis said he figured it was about 10 medicines, well, per person. And it's gone up for the whole year. It went up to more than that. So okay. Which one? Share content or share meeting window?
Share content.
Oh, okay.
And then PowerPoint.
All righty. I never can remember that.
There it is. And your cats.
And well, if I can get this thing to go. There it is. Yeah, you have my cats on here, but my other two fur babies are on here as well. Couldn't leave the dogs out. The white one is Taz, and he has, besides having the paws, he also has a blue eye and a green eye and a yellow eye. So he's got two different shades. And the other Siamese looking cat is Alana, and you can see all of her toes.
Yeah.
She has an odd number of toes. She has 23. A normal cat has about 18, and she has 23. One of her back feet has a different number of toes from the other one. And then I have the little dachshund, which is a piebald dachshund, which is a little bit different than some of the dachshunds you see. And he's got his most favorite thing sitting there in front of him, his ball. And then the husky, he's in his element in the snow. He wants to stay outside and play all day in the snow, which isn't always good for the person that has to play with it.
True.
So,
well, thanks for sharing those. That's really interesting.
So I thought we would start with them and then welcome everybody back for part 2. So we're going to talk about the medications, and we went over this little section before, and they do medications interfere with all vitamins, minerals, nutrients. They either block absorption, increase elimination, or inhibit production, or change how it's actually metabolized. And last time I shared the first 3 quarters of 2020, and this is all 4 quarters from January to December, in reviewing medications for 82 people with skin issues. Now, remember, there's only 82 people. They had 1,053 daily prescribed medications, and these are the ones that are done daily, except for topicals, the eye, ear drops, and PRNs. There was 254 psych and seizure medications and 210 nutrition supplements, 93 allergy, 89 hypertensives, 70 for constipation, 63 for reflux, and 38 for cholesterol. And it turned out to be 12, almost 13 medications per person. So that's quite a bit of medications per person. Considering that, we have a lot of medications besides vitamins and minerals. They also affect people's balance and walking and ability to swallow. So there's a lot of different parts of the body that medications can affect. So the most common medications were the psych and seizure, and this is basically I listed out the different vitamins that they interfere with, and vitamin D is a big one for almost all of these medications. your B vitamins, which is the folic acid, the B12, the B6, thiamine, and riboflavin, and the minerals calcium, which of course is really big for bones and muscles. Then you have CoQ10, which has to do with the mitochondria in the cell. It helps it produce energy, and it also cleans up free radicals. And then melatonin, which is what is for our sleep. It helps us go to sleep. Vitamin D metabolism is increased, which then it decreases absorption of calcium, and then it decreases absorptions of the other vitamins and nutrients. Now, nutrition supplements, while good, can also cause problems when paired with either paired with different medications or paired with each other. I see a lot of folic acid that's prescribed, and they don't usually prescribe all the B vitamins. And since folic acid can cause B12 deficiency, you have to really prescribe all of the B vitamins instead of just the one. Potassium can cause magnesium deficiencies. You can get iron toxicity if there's too much iron, and you can get zinc. Zinc is another mineral that is usually prescribed to help people with their skin, and it really shouldn't be given but a short time because it can cause toxicity and then depletes copper, which is something you need for your red blood cells. Some of the nutrition supplements, like I said, when paired with other medications, like the potassium and iron and vitamin C, when paired with the different meloxicam and aspirin, your antibiotics, and your non-steroidal anti-inflammatories, they can cause injury to the esophagus, and then that's going to impair people swallowing. Now, allergy medications, except for the Certizine, usually really just cause problems with people being able to walk, because when you get dizziness and low blood pressure and sedation, then you get people trying to walk end up falling, and also has a problem with their ability to swallow. Now, Certizine does deplete the B vitamins and vitamin C and iron. Your hypertensives, these are they can cause B vitamin deficiencies and magnesium, potassium, zinc, and calcium. The laxatives deplete a bunch of vitamins and minerals. Vitamin D is one. Again, the B vitamins, A, E, and then your bone minerals, which is your calcium, phosphorus, magnesium. Your cholesterol lowering medications, most of them deplete vitamin D, vitamin A, and your B vitamins, and your bone minerals, and CoQ10. Now, usually when I do a consult, if I see a statin, I do recommend vitamin D but that still makes it hard for the body to use the vitamin D, because statins lower cholesterol, which is what they're supposed to do. But vitamin D is made from a cholesterol. You have to have a cholesterol to convert the pre-vitamin to the vitamin D. The other thing is they compete with vitamin D for the same enzyme in the body, and they attach instead of the vitamin D, so you have a double whammy with the statins. And the other part of this is that there's two studies that have been published, one in 2010 and one in 2020. And they used a huge database. The 2010 used the NHANES, which is done every 2 years, and they study people from all over the country. And the 2020 study used the Framington Heart Study, which has been going on for years and years and has had amassed bukus of information. And both of those studies found that it was the added sugar in our foods that increased triglycerides, LDL cholesterol, and lowered the HDL cholesterol. So it seems that everybody pushes, staying away from saturated fat, whereas probably our biggest problem is not so much the saturated fat as it is the added sugars. Because one of the other things is when people have elevated triglycerides, that's what we ask them to do, is to decrease their sugar intake. And they can lower their triglycerides without really bothering with the fats.
Good to know.
Huh?
That's good to know.
Yes. Then you have your medications from reflux. It depletes the same group of vitamins, your B, your D, your vitamin C, your bone minerals, and it depletes gut bacteria and intrinsic factor, which is made by the gut bacteria. Now, there was also some warnings issued for GERD medications in 2011 and 2012. And in 2011, they issued that reflux medications lowered your magnesium levels, which means that magnesium is part of what helps the bones stay strong and healthy and what helps your muscles to move. And it increased fractures of the hip, wrist, and spine because you're depleting your bone minerals. And then long-term use increased the growth of Clostridium difficile, and that was the one issued in 2012. Now, intrinsic factor is basically needed to absorb all the nutrients, not especially B12, but it's basically all nutrients need that intrinsic factor. And beneficial gut bacteria is changed by the medication for reflux. Each person has a very unique bacteria, group of bacteria that inhabits the body. And what most people don't realize is that it's probably that group of bacteria, while technically not an organ, is probably one of the most important organs in the body. The beneficial gut bacteria is considered our second brain and our second gene pool. We need it for digestion and absorption. It does make up 80% of our immune system. So if you lose your diversity, then your immune system is shot. It regulates our appetite. It regulates metabolism. It ensures the integrity of our gut barrier. It actually is crucial for the development and maintenance of our brain. And it produces 5,000 different metabolites required by the body, including some of our vitamins. It helps produce neurotransmitters. It regulates our mood. It produces the short chain fatty acids that our body needs. And believe it or not, our first brain and our second brain, the gut bacteria, communicate with each other through the neurotransmitters to maintain all the different functions in the body.
Hey, Sherry, what can people do that need to be on these GERD medications long term, and it has an effect on their gut health? What is there?
Well, first of all, do they really need to be on long term? Or is it just something that's ordered and always continued? That's a question that probably you need to ask your physician, because you may not need to be on it long term. And then we have people that do not communicate verbally. So how do we know the person is actually hurting? I know people communicate other ways and they may be telling them through those other ways, but not everybody communicates that they're hurting at times. We have people with high tolerances for pain. So, sometimes it's one of those things that you have to step back and see is, do we really need this? Or do we need it just occasionally when they are having a flare up instead of long term? But if they have a problem, then I usually recommend a probiotic, but it's not, those probiotics are not our unique diverse flora that we already have, but they are sort of a stopgap. But still, while you're on the reflux medications, then you do have to take something to help in some way. And that is probably a probiotic to help.
Thank you.
Now, the other thing is the other part of this is that changes in the gut bacteria causes inflammation in the gut and causes the gut to let things leak out that it shouldn't. And that allows the bacterial endotoxins from bacteria that we don't need in our body to enter it. So it sort of allows, when you kill off the gut bacteria, then you allow basically the takeover by bacteria that causes issues, like the P. gingivalis. And this is a bacteria that we find in our mouth that causes gingivitis. When it changes residence to the gut, it actually causes inflammation because it changes the way that the amino acids are processed, which we need to make protein so we can build and maintain different areas of the body. Once the endotoxins get into the system and causes inflammation, then they can actually go to the brain and cause inflammation of the brain, which is one of the reasons, that if you don't need the reflux medications on it, for a long every day, then only when you have flare-ups would be better. Now, they also change the stomach pH because that's what they're meant to do. They're meant to lower stomach acid, but continuous low stomach acid causes increased digestion time. And your carbohydrates, all those processed carbohydrates that we eat that has no fiber in them, they sit there and ferment in our stomach. Fermentation increases gas. And so usually when the body starts building gas, then we add another medication for that. Stomach acid is needed for the food to reach the proper pH, and that triggers the opening and closing of the sphincter between the stomach and the small intestines so that it'll move on. If excessive pressure builds up and from the fermented carbohydrates and the low pH, and the valve between the stomach and the small intestines won't open, then it's got to go somewhere. So what happens is the acid in food refluxes back into the esophagus, which it actually then causes more reflux. So when the stomach does move the food finally into the small intestines, which eventually that does happen, it just takes much, much longer. The improper pH doesn't trigger continued digestion in your small intestines. So then you have large undigested particles entering your bloodstream, and that's going to trigger another immune response, which is going to increase the inflammation even more. And that triggers allergies and autoimmune diseases. And if the undigested food gets into the large intestines, then you have more constipation and or diarrhea, and then you get irritable bowel. So there's a lot of problems when you don't have the right pH or the right bacteria in your gut. Now, the beneficial bacteria, which we have, they've been doing a lot of studies on it. That's how they have found out it makes up 80% of our immune system and how it really is our second brain. There has been studies that has linked the inflammation underlying rheumatoid arthritis to the gut bacteria. And they have found that in the genetic studies in people with schizophrenia have found differences in the genes linked to the immune system. So there's, they haven't decided how that affects the diagnosis of schizophrenia, but they have found that there is differences. And then chronic systemic inflammation and brain inflammation has been implicated in development of depression, and the inflammation reduces the response to conventional drug therapies for depression. So there's a lot of issues with gut bacteria, and a lot of other medications also deplete that, but the reflux medications are probably the worst. Now, there are a lot of other medications out there that deplete nutrients, and one of the other big ones is metformin. We have most people with diabetes type 2 is on metformin. It depletes vitamin B12 quickly. So you really need to supplement with the vitamin B12. You don't have to do the injections. As long as you have your intrinsic factor intact in your gut, the oral medication or the liquid oral medication both work as well as injections. If you have problems with gut bacteria, then the B12 injections are the best route. Bone density medications decrease absorption of vitamin D and calcium, and they also cause jaw fractures, femur fractures, rib fractures, hip fractures, and wrist fractures. I know I've seen people on bone density medications with the low impact femur fractures. I've seen them with the hip fractures, the rib fractures, the wrist fractures. I've never seen the jaw fractures, but I know that some have had them. Most of your bone density, all the studies on them have found more on how they protect the spine from bone loss, but they usually don't protect anything else, especially the Fosamax, which is the one that's usually always prescribed. Okay, now I've told you what's missing and what the medications do. So what difference does that make? So I'm not going to go through all of these, but it will be there. Basically, these are the different nutrients and what they do for the body and what happens if you're deficient. Most of these have pretty specific things that they do, but they have some common ones. They always affect our immune system because all the vitamins and minerals work in concert. The skin and, things like your eyes and, that type of thing. Vitamin E is one of those is one of the biggest problems if you're deficient is it causes night blindness. It's also one that prevents skin breakdown. Vitamin E is an antioxidant, and it has to do with nerves and immune system. Vitamin D we've talked about. Vitamin K. Most people know about vitamin K when they're on the blood thinners. You're supposed to not eat the leafy greens. But vitamin K is a huge group of vitamins, and not all of that group of vitamins has to do with clotting of the blood. And basically you have K1, which is your blood clotting. This is the one that's in the leafy green vegetables. But vitamin K2 is used for building bone, muscle strength, and it seems to reduce abnormal calcification when you've had a break. And sometimes you have an abnormal bone growth back on that bone that's healed. And vitamin K2 seems to be one that helps to reduce that. So it's a little bit different. It's also not found in leafy greens. It's found in fermented foods. And like kefir. And it's also found in eggs. Of course, we know about vitamin C. It helps prevent scurvy, but it's a great skin vitamin. It forms collagen and connective tissue. It really helps prevent anemia because it's required. Iron requires vitamin C to be absorbed as well as stomach acid. Your B vitamins all are about energy, cell growth and development, helping you digest your food, and they maintain the nerves and brain. Usually, if you don't have enough of the B vitamins, you get neuropathy and cognitive loss. And see, one of the things from B12 is the cognitive loss associated with vitamin B12 correlates is an Alzheimer's like dementia. So sometimes is that cognitive loss due to the fact that they are developing dementia or Alzheimer's, or could they just be B12 deficient? And the cognitive loss has been correlated with low normal serum levels. So usually if it's within a normal range, the physicians do not do anything, but some of the most recent information says that 150 to 300, which is low normal, is correlated to cognitive loss. Intrinsic factor, of course, we've talked about water. It makes up the most of our body. We're about 50 to 75% water. And the only thing more important than water is the air. And if you don't get enough water, we tend to dehydrate and pass away. So most of the people drink soft drinks or Gatorade, or they drink juices, which has water in them, but anything with caffeine works more like a diuretic. It pulls the water out of the body. So you can dehydrate faster on things with caffeine. So that doesn't mean you can't drink your caffeine. It just means that you need to switch over to something caffeine-free later in the day. Of course, calcium, phosphorus, and magnesium are all your bone minerals. And then potassium, sodium, and chloride, they also help with muscle contraction and nerve impulses because they are the electrolytes in the body. But magnesium is an interesting little mineral because it, along with vitamin D, helps absorb our calcium, but it also is part of over 300 enzymes in the body. It also prevents platelet clumping, which is part of the atherosclerosis, and it relaxes blood vessels. And if you've ever had muscle cramps, that even though you're eating all the potassium, because when we have muscle cramps, you're told to eat potassium foods. If you're still having muscle cramps, it's because you're deficient in magnesium. And magnesium is one of those things that's really easy to find. If you can either take it by a pill, you can eat the foods that have a lot of magnesium in it, which is mostly things that people don't eat, which is vegetables and stuff of that nature. Or you can just get you some Epsom salts. Epsom salts is magnesium citrate, and it's absorbed through the skin if you soak your feet in it. It's one of those easy things.
Good to know.
Yeah. I learned that the hard way from mowing, and I was eating plenty of potassium. Took me a while to figure it out. Iron, we ever wondered why we have so many people that are deficient in iron? Of course, it's part of the red blood cells that carries oxygen all over the body, so we have to have it. But it requires vitamin C for absorption, and then the second thing it requires is stomach acid. So there we're going back to the reflux medicine. If it's lowering stomach acid, then you're not going to absorb your iron. Copper is also part of the red blood cells. Zinc, it's part of our immune system. It does make up part of the protein. It's used for wound healing. It helps to decrease inflammation. Cobalt is part of vitamin B12. Selenium is pretty well, we don't have too many deficiencies in it because it's pretty well spread across all of the foods, but it's part of a lot of proteins that makes up different hormones, especially the thyroid hormones.
Sherry, do a lot of the multivitamin supplements contain these nutrients? And is that something that's reasonable?
You have to look. Multivitamins are just usually the vitamins. The multivitamins with minerals have some of these in them, but a good part of these are not included in any multivitamins and with minerals, and you have to either get them from the food, but some of these you don't want to take in huge quantities, like, copper and zinc, selenium, iron even. You don't want to go past what is recommended because they can cause toxicity in the body, and then they create more damage than help. So it's best to get it from food than from one single nutrient, because as I said, nutrients work together. Iodine is part of your thyroid as well. Now, CoQ10 helps the cells generate energy, and it protects from free radicals. It also reduces inflammation, and it has helped to reduce blood pressure. Then you have your melatonin, which is part of your wake-sleep cycle, and then fiber. Fiber feeds the beneficial bacteria found in your gut. They use that for food. And it also helps to cut down the transit time from the time you eat to the time you eliminate. So what that means is then you don't have so many people that are constipated. But the part of the fiber that people don't get is that you have to have lots of extra water, because if you don't, the fiber will actually cause impaction. Even the fiber laxatives can cause impaction if you don't have enough water. Your amino acids, of course, they're part of every part of your body has amino acids in them. So they're part of everything. The fatty acids or the omega-3s, they make up our cell walls, our brain and nerve tissues. They actually coat the lungs, which is helps part to protect the lungs from the different bacteria that go into it, or the different things that can get in there and cause problems, like if you aspirate. And all of us aspirate, so we need that. And then it helps reduce inflammation in the body. So all of the nutrients are actually very important to the body, and it really is more important for them to work together. Because this last section is on back to vitamin D and research. And one of the things is that in a lot of studies that they've done on vitamin D and other single nutrients, the studies have contradicted each other, because they're using a single nutrient, and then perhaps they're not using the best or ways of studying. Because in the research for the different for vitamin D, the one thing that they're looking at, since all the cells in the body, almost all of them, have receptor sites for vitamin D, then it could play a big role in reducing health risk. And they've included studies on bone and muscles, falls, autoimmune diseases, type 1 and type 2 diabetes, cancer, cardiovascular disease, COVID-19, and many more. So that when they did the studies, you'll find studies that found that it helped and studies that found that it didn't. So some of the studies had some flaws in them. They didn't establish a baseline vitamin D level in the population they were studying. Some of them studied only people with adequate vitamin D levels. The study time frame was a very short time frame, or some of the studies had the participants in the control group take vitamin D supplements, which then skewed them as a control group. Some of the best studies have been in bone health and muscle function and falls. Several of the studies found that vitamin D3 could reduce hip fractures by 18 to 20%, using about 500 international units to 800 international units. The 400 international units and less didn't offer any protection. On muscle function and falls in older adults with the deficiency, the risk of falls decreased 12 to 19% using 700 to 1,000 international units of vitamin D. Anything below that didn't give any protection. And they were giving this on a daily basis, so protection appears to come from about 800 to 1,000 units given daily, instead of large doses, less frequent. One study looked at just hip fractures that required surgery, and they looked at the mobility after surgery, and people that were vitamin D deficient had reduced mobility after the hip surgery. Now, one study did look at giving yearly doses of 500,000 international units of vitamin D for 5 years, and giving that much vitamin D caused toxicity, and the toxicity from that vitamin D increased falls and increased fractures. So, whereas the daily doses didn't appear to have any problems with toxicity, and it did actually help. There's been a lot of studies done on cancer, and they didn't really find that it reduced the risk of cancer. But what they noted was that since the study was only for 5 years, that most cancers take much longer, 5 to 10 years, to develop. And it didn't show reduction in any risk of cancer. What it did show that people with adequate vitamin D levels, it reduced the rate of death from cancer. Heart disease, they've looked at doing studies for heart disease because the heart's a big muscle and it has receptors for vitamin D. And since vitamin D is shown to improve muscle strength and reduce inflammation, they were wanting to see if it would play a part in heart conditions. What they found was it didn't decrease the risk of heart disease, but in healthy people, but those that were vitamin D deficient, they were at more at risk of heart disease. So it didn't seem to decrease the risk, but it did. If you are deficient, you're probably going to end up with heart disease. They have done studies with mental health disorders, especially depression. They didn't find that it reduced the risk for depression, but the study did say that they felt that certain populations might find it beneficial. And the reason probably is because since different nutrients act together, whole foods shows different results than a single nutrient. They did some trials on depression using whole foods. And what they found is if you have a good quality diet, then your risk of depression is decreased. And that there's a lot of evidence now coming out that poor diet is linked to, can be linked to mental health disorders.
Hey, Sherry, I hate to jump in here, but we're getting short on time again. And there's a couple of questions here in the chat box we wanted to address if we could. One of them is asking if you're familiar with the effects of hypo or hyper measures of hormones like thyroid on mood and mental health of people with disabilities. And then could it be well that when a person with disabilities, especially those with communication differences, experiencing mood disorders, non-baseline presentation, is it? I can't see all the presentation that they receive blood work testing for hormone changes, especially thyroid.
Yeah, I would say that your hormones definitely are going to affect your mood, especially your thyroid, and whether it's hypo or hyper. And so if you do have some issues, it would be good to get them checked. You can also check for your different vitamin levels. Vitamin B12 is a good one. Your vitamin D, because they can do all of those pretty much together. And then, work from there, because untreated hypo or hyper can, cause a lot of problems. You have, fatigue, and you do have mood changes. Hyper, you get, a person may show, aggression or irritability, as well as weight loss from hyper. It's always good to to have your different nutrients, because some of those nutrients also make up those hormones for the thyroid. So did I answer those? To make sure I got all that answered.
This is Johnny. I asked the question. Yeah, I think so. And for fear of running out of time, I think it could be interesting that could be standard practice for physicians who are seeing individuals who are non-communicative people with disabilities who are experiencing behavioral or mood challenges, that it becomes standard practice that they do blood work to determine hormone levels. But
Yeah, and they need to do those, and then they also need to do some of the vitamin levels, since some of those can, some of those do influence or make up those hormones, and then they also, some of those deficiencies can reflect in behaviors and aggression and things like that.
Sherry, one of the other questions we had is, should the vitamin D international units be increased for a person with osteopenia or osteoporosis?
The 800 to 1,000 international units given daily seems to work the best. And if you do then a multivitamin with minerals that includes your calcium and some of the magnesium and some of the other bone minerals in there, it should help prevent some of those fractures or prevent it from moving on into osteoporosis.
Sherry, I had a few questions that were sent in privately as well. One person stated, I review people's records all the time. Almost 90% of people diagnosed with GERD take medication for it and have seasonal allergies and take medication, some seasonally, other the medication is scheduled. Then most have chronic gingivitis. Is it really a cycle? Doctors prescribe them and don't appear to be concerned. How can pH be checked?
Yeah, they do prescribe them, and then they never discontinue them. And if they have gingivitis and they're on reflux medicine, then those bacteria in the mouth is going to move into the gut, and then you're going to get the inflammation of both the body and the brain, and that's going to increase allergies for sure. Allergies are a good sign that you've got inflammation somewhere in the body. And if you're on reflux medication, you're not helping that second brain at all, or your immune system. So I try to usually, when I do consults, if they're on reflux medicine, I do make a recommendation for probiotic and to see if the doctor would consider discontinuing the reflux medication. Some do discontinue reflux medication. It's going to take a good month to get that system going again. So there will be some problems in between, and that's why we sort of try to bridge it with the probiotics.
Sure, you've given us so much good information. And I know we had several people ask last time if they possibly could share some of your presentation. And I know you didn't get a chance to get all the way through it again today, but those slides you showed us today were so interesting about all the information you provided on the various vitamins and minerals. And could you possibly maybe put that into a little package that we could send out to folks that were interested in that?
Sure.
Thank you so much.
And I've got a few other questions that were sent in privately. Since we've got 2 minutes left, if you take insulin, how does that impact the vitamin absorption?
Insulin does impact it. It does deplete some of the vitamins and minerals, and right offhand, I have that information, but I don't. Right offhand, can't remember it.
You're
Sorry.
fine.
It does impact it. The insulin that our body makes doesn't have the same effect. It's just the insulin we take through injection does have some effects, not as much as some of the other medications, and not as much as like the metformin with the B12 and other nutrients. But
okay.
I'm sorry, I can't remember
Hey.
which ones it packs.
You're totally fine. So what is the best thing people can do overall to balance their gut health?
Wean themselves off of the reflux medicine, and then if they are on some of these other medications, which does impact the nutrients, basically the biggest way to impact your gut health is to eat better and to eat the foods that feed those gut bacteria so that the good ones will come back. And that's your fiber. And that's really eating a healthy diet. And I think I've got, oh, yes, I've got it. Sorry about that.
We had one other question that came in before we wrap up because I know we're out of time. So how is reflux diagnosed in someone who is unable to communicate about it? Is there a definitive diagnosis for that?
Unless they are showing signs that they're hurting, like holding their stomach, or when they, or their chest. If they're telling you in that way, you could probably pretty well assume that they are refluxing. But if they have no way of telling you, then you really don't know, and you can't make a definitive diagnosis.
Sherry, we've heard that people will sometimes put their hands in their mouth that
Yeah.
have GERD, and then people don't want to eat that have GERD.
Yes, there are signs that they do that shows, but if you have one that's not doing any of those, and you're saying say they're having reflux, then you would have to probably have an upper GI done to be able to know for sure if they were refluxing. But just to go in and have the doctor say, oh, well, they're refluxing, there's no way of knowing unless you go to the gastroenterologist and let them do the upper GI.
Yeah, I know. It is just it is difficult. There's so many people that are I really related to the comments you made about medications, because that is such a big problem. Doctors prescribe medications, and then they go to another doctor, and that doctor adds on medications, and nobody's going to discontinue medications that another doctor wrote unless it's contraindicated with the medication that the doctor wants to write, and you just get this huge pile of medications that everybody is on, and it is so I guess it's kind of intimidating to talk to doctors about discontinuing meds, or maybe they feel like they're being questioned or something, but that's certainly something that anyone can do, even though it does seems like that it's a difficult thing to broach with them. There's certainly no harm in asking if you think that someone is just on way more meds than is actually needed. Sherry, I wish we could go on and on and on. This is just so interesting because it is, especially this part about medications. I'm with you on this with the medications. I know that we have so many people that take so many medications, and that is such a difficult thing. And heck, that just kind of leads into maybe you might come back with us again some other time.
Oh, anytime.
Well, that is, thanks so much, y'all. Really appreciate you coming back again today, and thanks everybody for attending. And this has been the CCN, and appreciate you coming, and we'll look forward to seeing y'all next week.
Bye.
Bye-bye. Take care.